Okay, hi everyone. Thank you so much for being here at the Art of Contouring with AlloClae. My name is Nikki. I am Dr. Hill's surgical coordinator here at Fulcrum Aesthetics and Surgery. Um, today we're going to just be discussing one of the most exciting and newer advancements that I think in the non-surgical body contouring, and that is AlloClae. This treatment it has really created new options for patients who are looking for a natural looking volume restoration and contouring without traditional surgery, implants, or liposuction. So it's really nice. Today we're going to walk through what AlloClae is, how it works, who's the ideal candidate, and your treatment areas, recovery, and what makes it such a unique option. Okay, what is AlloClae? AlloClae is considered a structural adipose filler, so it's fat, adipose fat tissue, meaning it's designed specifically to restore volume and contour in areas where your fat naturally exists. So, unlike traditional fat grafting, which would require liposuction from an area of your body, so let's say typically your abdominal area, which would mean surgery. Um, so so that would be harvesting your own fat. AlloClae is a ready-to-use purified adipose tissue product that can be injected strategically, and it's there to help create support, contour, and natural looking volume in your body. One of the biggest advantages is that patients can achieve this enhancement without undergoing a larger surgical procedure or going under general anesthesia. Why patients are interested in AlloClae? Well, one of the reasons that patients are so interested in AlloClae is that it fills that space between fillers and surgery. It's just new and exciting, and it's it's I don't know, it's juicy and nice, and it's doesn't have that down surgical time. So you get that achievement of having that fat grafting, which again, without having surgery. So again, it's for patients that maybe don't want the actual breast implants, but they want that fuller look in their breasts, or they don't have enough fat for the fat transfer, very naturally thin, or lost weight from GLP-1s. They want maybe something a little less invasive. Uh, it's a really exciting option for these types of patients. Treatments are typically minimal, non-invasive. Downtime is significantly less than surgery, and results can often be seen immediately. The goal with AlloClae is typically soft, natural looking enhancement and contour, and not an overdone look. Common areas that can be treated with AlloClae. So AlloClae can be used in several different areas of the body. I mean, really anywhere there's any kind of irregularities, you can be used. Um, it's just it's a great product. Some of the more common treatment areas include your hip dip area, so kind of where the kind of can go in a little bit, that little dip that happens. It's a great place for AlloClae. The buttock contouring, as we age or even with weight loss, that butt can kind of go in a little bit when we want a little more lifted. Breast contour irregularities, implant rippling. Sometimes with implants, especially on a thinner patient, you can get a little rippling still. And so the AlloClae can be placed around that area in the breast to cover up that. And again, in areas of volume lost after a significant weight loss. Sometimes we go on these GLP-1s because we want to lose weight, and then we're like maybe just not in that area. So AlloClae is a great solution for that. We use to improve certain contour irregularities and support smoother transitions in the body. So again, that's why it's great for those hip dips. Some people just kind of want that smooth transition down their body. Everything is going to be highly customized based on your personal anatomy and your personal goals. Who is a good candidate? So, ideal candidates are typically patients who are looking for a subtle to moderate enhancement without traditional surgery. This is especially helpful for patients who may not have, again, enough body fat for fat grafting procedures, or for patients who simply want less downtime and recovery. It's also a great option for patients looking for softer, more natural contouring rather than, a dramatic surgical change. Um, and as always, just a consultation and proper evaluation are incredibly important to determine if you are a good fit. So I highly, highly encourage you to give us a call, speak to someone at the front desk, Bobby, Olivia, Ashley, or Kayla, or myself. Give me a call and schedule that consultation with Dr. Hill. What to expect during treatment? Okay, you called, you have your consultation, you're ready to go. What to expect during that treatment? So it is going to be an in-office procedure unless this is something that we have added onto your surgical procedure. But typically it's going to be an in-office procedure. Typically anticipate to be here 45 minutes to an hour. It's easy breezy. You're going to have like a local anesthetic that's going to be injected with it. So the pain is going to be minimal. Um, so the product is going to be strategically injected into the treatment area in a customized way based on your aesthetic goals. It's going to be injected to create that contour and volume exactly where it's needed. One of the advantages is that it's in and out, like I said, 45 minutes to an hour. There's no, you can drive. You're not waking up from any anesthesia or anything like that. It's a tailored, it's a tailored treatment to you, and that's that. Your recovery and downtime. Again, your recovery and downtime is going to be dependent based on your personal, aesthetic goals. If this was, a buttock area, or maybe you had someplace, I personally myself, Dr. Hill did AlloClae in this area. So my downtime compared to someone having a large amount placed in their breast or their buttock is going to be different. Larger amounts of AlloClae being placed, will probably have, you will have prescriptions that will be sent with you, whereas smaller, more minimal, you don't necessarily need as much recovery as downtime. But so your recovery after AlloClae is typically very manageable compared to traditional surgery because again, you're not recovering from general anesthesia. And patients, you can expect some swelling, soreness, or bruising. Um, but it's all very manageable and most patients are going to return to their normal activities fairly quickly. There's going to be things that we're going to ask you to not do, like don't ice the area because it is fat, but just make sure that you follow all of your post-op instructions from us that we will give you. We're always available. Um, and yeah, the recovery and downtime overall, it's considered a much easier recovery experience than traditional body contouring surgery. Why AlloClay stands out. What really makes AlloClay stand out is it was designed specifically for body contouring. So unlike traditional fillers, this product is adipose based, again, that fat tissue, and it's intended to create a soft tissue support and natural looking volume in larger areas of the body. It offers a different approach than implants or fat transfer while still aiming for soft, elegant, natural results. For many patients, it creates an option that simply didn't exist before. So again, if you're a patient that you just don't have the fat on your body, maybe you just aren't comfortable going under general anesthesia, it's a wonderful, wonderful option for you. My favorite before and afters. So these are the hands, which is another wonderful place for AlloClay to be as we age. What do they say? The neck and the hands age first. So lucky. So here's a beautiful before and after of the hands where Dr. Hill injected AlloClay, which is gorgeous. And then next is my other favorite, the breasts. So this is AlloClay, 125 cc's per per breast, and this is no implant. This is just AlloClay. I mean, these are gorgeous, natural, beautiful results. I should mention that AlloClae does come in many different sizes, which we can discuss during your consultation. The smallest CC is going to be 12.5 cc. So you're going to think that is going to be more for the hands, facial area, kind of that smaller adjustment. Once you get to the breast, hip dip, buttock area, we're going to be more in 50 plus, you know. And then sometimes some people come in and they start with 50 and then a couple months later we add more. We build. But this was 125 per breast, one and done. Gorgeous. Okay, important considerations. So, as with any treatments, consultation and individualized planning are extremely important. Every patient's anatomy, goals, lifestyle, um, are different, therefore, your treatment recommendations should always be customized. Having realistic expectations is also extremely important. The goal is enhancement and contour and improvement in a natural looking way. So, again, consultation is key. All the information, you'll get all the information there. You get realistic expectations, realistic understanding of what the amount of CCs is going to need for what you want to achieve, pricing, everything. Is AlloClay right for you? If you've been considering body contouring but aren't quite ready for surgery, implants, or traditional fat transfer, AlloClae could be a really exciting option to explore. So the best way to determine it is, again, that consultation. So give us a call, give us a call, ask for me, call me up if you have any questions for me. I'm here for you whenever you need me. So again, with AlloClae, the goal is always to create results that feel balanced, natural, and beautifully tailored to you. Okay, before I open it up to questions, I just want to send out an offer that right now we're offering free consultations if they are in regard to AlloClae. And this is going to be valid until July 10th. And then if you do receive that treatment with Dr. Hill for your AlloClae, you will also receive a free tote and the Solar Edit SPF, which we all need to keep that skin gorgeous. You can text or do the QR code to schedule. Okay, I'll open up to questions. Um, okay. How long does AlloClay last? Um, Typically, I mean, it's fat. So it again, it's going to be dependent on everyone's lifestyle. So it can last forever, but it is gonna, if you are going to lose a large amount of weight, so is your fat. So it's going to be dependent on your lifestyle, but typically, you know, it's your fat, so it's there. It absorbs your own tissue. Okay. Will I need multiple treatments? Um, it is designed to be a single treatment, but again, like we discussed earlier, sometimes people do like to add a little, start with a little bit and then add a little bit more. We can use it as a builder. It can be tailored to however you would like it. Um, okay. Let's see. This one, I have a question. You mentioned you had it in your face. Where specifically? I have had it right here. So I had, for me, this was a great option. I am 45, going to be 46 in a couple months. And so for me, I had a lot of volume loss. I've always been a big cheek girl, and I had a lot of volume loss here. I had a maybe 5, 6 years ago. I tried the filler and it just wasn't for me. It made me swell too much. And so I just stopped kind of treating that area, but I had volume loss, so it was kind of like I stayed chunky here, but not here. And so Dr. Hill filled it right there, and I could not be happier. I because I love it because it just goes right into my same cheeks. It doesn't, I don't feel, sometimes you can feel, I don't know, I can't feel it. I love it. What is the cost? The cost is going to be based per cc. It starts at 12.5 cc's, and the next size is going to be 25 cc's. The size after that is 50 cc's. After that, 75 cc's. So we can go through all cost during the consultation. Would this be something in place of a liquid BBL like Sculptra? I mean, this is something that definitely you can use to create volume in the buttock area. So, yes. All right. Thank you so much. Oh, one more thing. Sorry. Really exciting for next week. Make sure you tune in. We have Deja. She is going to be discussing medical grade chemical peels. So please tune in. You don't want to miss it.